If you're like most women, you treasure your hair and will do whatever it takes to make it look fantastic. So if it starts to thin out or even just fall out, what is a girl to do? News 4 troubleshooter DELAINE Mathieu talked to a dermatologist about some of the common causes of female hair loss and what you can do to stop it.
It's my everything. It's my baby.
Like most women, Cheryl Pulliam-Jaramillio loves her hair. So when she noticed that some of it was falling out a few weeks ago, she freaked.
Oh my goodness, I was like, am I going bald? I'm like, oh my God, I'm gonna lose all my hair. I started looking into getting some wigs.
Hello. Hi, how are you today?
Fine.
She saw a dermatologist and was diagnosed with a certain kind of alopecia, hair loss. Pattern alopecia is actually genetic and most common among women over 70. But it can also happen in women who are really stressed out, which, let's face it, is a lot of us.
Normally maybe 10 to 15% of your hairs are in that resting phase, waiting for a new hair to push it out. And what happens is with that stress, then you might have maybe 20-30% of your hairs, all of them at once, go into that rest phase. And then 2 or 3 months later, when new hairs push it out, all those hairs come out at once and it comes out as clumps of hair.
Dr. Osswald says there are a lot of things that can trigger hair loss in women. Hormonal changes, crash diets where you've lost a lot of weight suddenly, new medications, and the biggie, having a baby. That's me right after my second was born. Normal head of hair. And a few months later, I had a lot less of it. So what can you do about it? There are a lot of products on store shelves out there that contain growth stimulants like minoxidil. Dr. Osswald says some of them may actually help with mild cases.
When I'm blow drying my hair, I'll flip it over to try to, and you blow dry it there and then flip it back.
April Young has tried just about everything to make her thinning hair look thicker.
Shampoos, vitamins, anything, mousses, hairsprays, serums, conditioners, you name it, I'll try it.
She also tried a new product called Hair XT100.
I liked it. I noticed that my hair was thicker. It was growing faster.
We showed it to Dr. Osswald.
Well, I think that this one has a lot of vitamin supplementation in it, and there's some biotin in it, which some people have used for hair loss, so I think it's okay.
She says just keep in mind there's not a lot of scientific evidence out there that proves these ingredients in any of these products helps your hair grow.
There's hope out there. There's a lot of stuff.
As for Cheryl, her crowning glory is on the mend, thanks to steroid injections and a lot less stress.
I feel fantastic. My hair's coming back. I have a little thinness, but it's all coming back.
Now there are certain types of alopecia that are very serious, like alopecia totalis, where all the hair on your scalp falls out. And worse, alopecia universalis, where all the hair on your body falls out. If your scalp is sore or itchy and you're losing clumps of hair at a time, see a doctor immediately. I'm News 4 troubleshooter DELAINE Mathieu.
All right, the weather.